So a topic that I've talked about in the past is something called 3D or three-dimensional rejuvenation. What does that mean? That means that we age essentially in all the layers of our face. So our skin ages, we lose soft tissue, and then the underlying supportive tissues start to droop or sag. So if we really want to create comprehensive, natural-looking rejuvenation, we really need to think about all three layers. How do we do that? Well, each layer is treated differently. So for the skin, we might do things like laser resurfacing or microneedling, chemical peels. There are a whole host of treatments that can be used to rejuvenate the skin. And rejuvenating skin means improving the texture as well as color. We get discolorations from sun exposure. So skin is one element. Next layer down is volume. Lots of different ways to restore volume. Fillers. There are a bunch of fillers that include hyaluronic acid, calcium hydroxyapatite, fat transfers, and then the longest lasting one is going to be Bellafill. So if we're talking about rejuvenating a large portion of the face, we want something that's going to last long. And then lastly, that last layer is that supportive layer, and that's where surgery comes in. So there are some patients where I'll do surgery to start with, add a little bit of filler, and then lastly do some laser or other type of skin resurfacing. So if I've addressed all three layers, they're going to get a much more comprehensive, beautiful result in the end.